Well, good evening, and welcome to the 7th Summer of Healthy Living Lectures, brought to you by UAF Summer Session, Lifelong Learning. I'm Mike Powers. I'll be introducing tonight's distinguished speakers. As a reminder, these lectures are the result of Michelle Bartlett's efforts, the incredibly effective director of UAF Summer Sessions and Lifelong Learning. And just as a 35-year observer of the university, I think Michelle is among the university's greatest champions of this town-gown relationship, connector and an advocate extraordinaire in demonstrating the value that a university brings to a community's quality of life with the depth and breadth of lectures and courses and travel programs, school programs offered through her department. A reminder about our lecture series. Mondays, Writer's Corner. Last night, Dermot Cole spoke regarding his book on the great 1908 New York to Paris auto race. Tuesdays, of course, Healthy Living with a strong emphasis on local medical perspectives. Tonight on COVID specifically, next Tuesday will be Dr. Grayson Westfall regarding the patient-physician relationships and the internet. Wednesdays, Discover Alaska. And tomorrow features Tom Budson, president of Pacific Rim Geological Consulting, and his talk will be regards the mining pioneers of the Fairbanks area during the Alaska-Yukon Gold Rush. Thursday nights, wonderful Music in the Garden feature, and tomorrow features Cold Steel Drums. And just a reminder for those who have not yet been vaccinated, the university policy, simple community courtesy is to require a face mask. And again, if not vaccinated, please wear the mask. After tonight's presentation, there'll be a reception. Please stand by to chat with Dr. Ramirez. For those live streaming tonight's discussion, note that the link on the bottom of the screen allows you to submit questions. And with that, I will introduce tonight's first speaker, and that is Dr. Angie Ramirez, who is the Chief Medical Officer for Foundation Health Partners, owner and operator of Fairbanks Memorial Hospital, the Denali Center, and the Tanana Valley Clinic. Angie was a key reason the Foundation and Health Partners was able to quickly implement practices, procedures, and protocols that has resulted in a remarkable effort across the hospital, clinic, long-term care continuum in Fairbanks, as well as contributing from a more public health perspective. And I'd like to note Dr. Michelle Nace here, Mark Simon, we're also part of this incredibly effective team as you watch from the outside. Dr. Ramirez is the former executive medical officer for Tanana Chiefs Conference and the medical director for Chief Andrew Isaac Health. She spent 20 years at Parkland Health and Hospital System in Dallas, 10 years working in the clinics, and 10 years at the hospital. Her special interest relates to quality improvement initiatives. She plays a primary role in setting FHP's strategic vision relative to quality initiatives in all clinical areas within the Foundation's health facilities. Roughly 25 minutes into the presentation, we will move to Dr. Ann Zink, who was at the 11th hour called away for another presentation down in the Palmer area. That's why she's not here. Nevertheless, please welcome Dr. Angie Ramirez.
Oh, wow. Thanks, Mike. And do I have my slides? There we go. So thank you so much. And actually, that was so wonderful hearing the round of applause instead of having that Zoom clap sign. So this is great, having a live audience, first time in a long time. So tonight's theme is resilience. And this has actually been the theme for this whole past year. What I'm really going to talk to you about is just kind of some stories from a little bit behind the scenes as how I've experienced. So I'm just going to share that. And hopefully some lessons kind of learned along the way that can help all of us as we move forward. So this is just a little graphic that I love to look at periodically to remind myself of all the things that I need to do to kind of practice resilience. Okay, I'm learning. going to be resilient here. So again, a lot of us in healthcare have really practiced for emergencies, practiced for disasters, prepare. But usually what we have thought of is a disaster like an earthquake, a tornado, a hurricane, maybe even the flu epidemics, but something that lasts a year or more. And what we've all experienced this past year, where it's not just at work, but also at home, everything has really made everybody tap into kind of this theme of resilience and talk about it and learn about it and really think about what it means. So moving on. So a couple of stories. So Dr. Nace will recognize one of these. So so again, going to highlight some of those themes from that little graphic. One of those was like, be honest and be yourself. So we started doing this public health campaign, right? Sharing messages. And I seem to always have those serious messages. And somewhere along the way, for a very temporary moment, I was Debbie Downer, but didn't really like that. And Michelle over here was Positive Polly. But we came up with a much better name for me, and that was Factual Francis. And that fit with me because I felt like I kind of had to tell people the truth and what was happening and kind of get people really understanding how serious this was, what was coming down, and quite honestly, that we needed to be prepared. And I was not the sort of person to kind of put flowers out and make it all pretty. It was just like, here's the facts. We got to figure out how to deal with it so we can move forward. So that's me being Factual Francis, and that's me having some friends who kind of put a sign on my door to make sure everyone knew it. The certificate came. I'm not a person who likes press conferences or public speaking, but we learned early on, we decided very early that we wanted to be transparent. This was big, this was serious, this was new, this was different. We were all learning. And so we wanted to share when we had a positive case, when we had a hospitalization, our first death. We wanted everyone to know what we were going through and what was happening at the hospital, so that, again, it was really important to have a relationship of trust with everybody. And so we wanted to have that transparency. And one day there was a press conference where it was a pretty intense one. And there was a reporter who basically I felt attacked and was singing to the way I was feeling. I don't want to say it was intended, but the way I was feeling was, it was as if it was my fault. How did we allow this to happen? And how we were so bad, et cetera, et cetera. And Jeff Cook, our president, was on the line at that time, and he had my back. And he stepped in and just immediately pronounced me the leading medical expert in the country, and they needed to be quiet because I knew exactly what I was doing. And when I got back to my office later that day, my team had posted a certificate on my door, had my back. But I did want to share a little bit about how did I get there? How did I know so much at that time? And I think I started at FHP 2 weeks prior to the first CDC notice. And yet 2 months later, I was kind of leading the COVID response. So a lot of it's just being in the right place at the right time. And so in the room also is my daughter, so I'm being the proud mother here. She just graduated a few weeks ago and was the recipient of the Principal's Award. But she was born in December 2001. We adopted her in spring of 2003 from China. We had, her adoption was delayed for 2 months after we had the match, and she was our daughter, and we knew we were going to get her. The SARS outbreak occurred. And so it was a very personal experience for me, understanding SARS was a coronavirus that came out in 2003 and spread for about 6 months and spread to Canada. And but then at that time, the outbreak was over. But because of that personal experience, I knew about it, paid attention. When we went to China, we went through all the temperature monitors that they were screening everyone with. We saw people wearing masks. I was a physician, and so I kind of read about it and was paying very close attention to it. And that was actually when the first research started on mRNA vaccines. was with that SARS outbreak. And a lot was learned from it and how it transmitted and quite honestly, how quickly it can spread. And so ever since then, I had a heightened awareness for viruses coming out of China, how quickly they can spread, how much they can do, as well as the measures that you have to put in place to prevent that spread. Second learning moment that was personal for me was I was in Dallas at the time when Hurricane Katrina, and Dallas took 25,000, well, actually North Texas took 25,000 evacuees in a very short period of time. At the time, I was at the county hospital and I was over the community clinics, and we sent a van out to the arena to take care of folks. And we learned a lot very quickly that they needed more than a homeless van. We ended up setting up a field hospital in the course of probably about 3 days from volunteers from all over the medical community. I think a couple things I learned from that experience was that, so our trauma team ended up taking over the field hospital, but they were at the hospital, they were prepared, kind of waiting for a disaster type preparation, not realizing that happened. They came over probably about day 5, day 7, set up the incident command. So a couple things that I learned. One was the real value of the incident command structure and how it really made it work more efficiently. But I also learned from being on the ground, it was a lot better, even though they set all that up, they were still coming back to those of us who were there on day 1 and asking us how this worked, how that worked, because we had set up all these relationships early on and things moved so fast that I really understood the value of being in on the ground floor. The other thing I think I learned from that experience was just all the connections and the importance of communication. We ended up setting up a telephone conference call every day, and it's just because we didn't have any other way. And we just gave out the number to anybody who wanted to join in. And again, it was all volunteers, many of them not from our organization, but it was a way that every day we kind of huddled and coordinated. So kind of learned about the pace of change at that point. I was also in Dallas at Ebola. So this is a little bit later. I was over occupational health at that time. So one of my personal heroes was a nurse. And she was a nurse who volunteered because it was the right thing to do to take care of an Ebola patient. She worked at my hospital also, and I was over occupational health. Because she was that kind of person, she disclosed to us that she was taking care of an Ebola patient and wanted to make sure it was okay. CDC, everyone else said it was okay for her to do other work. And we were good citizens. And so we said, thank you for disclosing. We want to support you. And she continued her shifts at our hospital. Then later, a healthcare worker contracted Ebola. And at that time, we told her, she had to stand down. And she completely understood. We also talked to CDC. CDC said she could continue to work, but there was no understanding of why that healthcare worker had been infected. And so we decided it was a better course to have her stand down. A second healthcare worker became infected. And at that point, the CDC said everyone taking care of the Ebola patient had to stand down. What I learned from that experience was we had to go to Doctors Without Borders to get information on how to manage occupational exposures, how to protect our staff, and also quite honestly, how to work with that particular nurse. And I also kind of learned how the CDC is an important resource, but sometimes they can be fallible and they're more like a think tank in research. And when you're on the ground, you kind of have to go to the resources of people who actually know what to do. And sometimes that's overseas and not actually here when it's new diseases. So these are experiences that I personally had that really helped inform me in terms of when the first CDC notices started coming out, paying really close attention and needing to get prepared. So my network of people, I think Michelle Nace, I think that might be you, maybe. And so again, it's really important to have a lot of people. As Mike mentioned, it was a team. It was a team around communication. It was a team around how we did testing. It was a team around how we do community protocols. It was a team when people got tired and needed to talk to somebody and get advice. And that's, again, a huge theme of resilience. You have to work with others and kind of stay connected and work together. And so we did a lot of that this year. Denali Center. So this was a night that I always talk about, that it became real for everybody at the hospital. Prior to that, people really didn't know for sure what was happening or what was going to happen. But when we had our first positive at Denali Center, the administrative team and the COVID response team was in the hospital. It was a Friday night that I'll never forget. And I think we were there till about midnight. And what everyone had in their head was the possibility of headlines similar to what was coming out of what had come out of Seattle and the Evergreen nightmare. And so we put in place protocols. We decided, we took an approach that was, again, this was about kind of, it was very serious, and we took it very seriously, and we took an approach where we did absolutely everything possible that you could do. And so anything that had any possibility of being successful, we did, with the idea that you had to do absolutely everything. At that time, there was no blueprint for this. It turns out later, and we didn't know it at that time, but what we ended up doing ended up becoming the blueprint. And the CDC actually did ask our director of long-term care facility to spell out everything that we had done. But we ended up isolating every single resident. We tested every single resident. We tested every single staff member. Hundreds of tests happening. Huge close partnership with the lab. We actually tied up the virology lab here and backed them up for days, but they came in on the weekend. They were awesome partners to get all the testing done. We went through, I asked our infection control person, because I can't remember the figure, but isolation gowns, because we had to, we changed for every interaction. So we found out we were going through 180 gowns for every meal service. And so that was not sustainable. And so we had to, 3 days later, we found out, even though we had a stash, we were burning through it at an incredible rate. So we had to kind of change the protocols. But that gives you an idea of the massiveness of the effort that was there. But over the course of several weeks, we didn't have any more transmission. We had broken the cycle. Eventually, everybody came out of isolation. Eventually, we had a Mother's Day parade. People were outside. The reindeer is like my favorite. That was such a joyful moment. The story that I still remember being told is one of the residents, when they saw the reindeer, actually there were two stories that were told. One resident who was not very verbal and had not been saying anything. A lot of folks had developed a lot of depression during that time. Burst into song, singing Silent Night. It was just beautiful, and everybody was so moved. Another resident, apparently I wasn't there, but I've been told several times it's actually happened, but muttered under her breath, dinner. So, very Fairbanks, very Fairbanks. So gratitude was another theme of this year, and being thankful, because again, it was hard. It started off, we thought we'd learned what we needed to do, but then it kind of kept coming and other things kept happening and things would get better, and then there'd be another surge. And so we really started thinking about resiliency and how do we help our staff? How do we help ourselves? And so gratitude became a huge theme. Listened to a lecture that was phenomenal out of Duke and really talked about, naming the 3 things that you're grateful every day. And that's putting a name to that helps change your mindset, helps look at things differently, which I'd always kind of heard, but that's in that field of meditation and wholeness that I never have time for. But all of a sudden I was really needing it. And that actually, they had done studies out of Duke, and that if you did that for 2 weeks, so this is kind of my language now, right? If you did that for 2 weeks, you got the same type of protective benefit for a year of taking an antidepressant. So something that actually really made a huge difference, and is a small dose that almost anything could do. If you don't meditate, if you don't jog, if you don't do those things now, it's kind of hard to start when you're in the middle of a pandemic. But everybody can kind of take 5 minutes to think about something good. And also, it's really, really true. Sometimes, and I did this with some friends every night at the end of the day, you know, what are your 3 good things? And people, sometimes at the beginning, it was kind of hard to think of. But it changes your mindset and how you look at things. And so all those gratitude journals, I think Michelle had a gratitude journal. And this is Grayson's child that had a box of gratefuls that got taken home and to other environments. I love the story about the night shift on 2 South. That was one of their boards. They really got into the nurses there every night, writing down the 3 things that they were grateful for. And so it really kind of made it not a contest, but everybody was helping everybody else. And I think it really made a huge difference. And it was a recurring theme throughout the year of how we can incorporate gratitude for each other, what's good, and where we're going. Learning from mistakes. You know what I'm going to say here. So my daughter, so this is the recent surge that we had, and the New York Times, we made the New York Times, not a good thing. We made it because we were for one day, we were one of the top 10 places in the country of the US in terms of our rate for COVID. My daughter pointed out that, yes, my name was in the New York Times, but the only quote attributed to me was that I was wrong. So I will say, and I did say that I was wrong, and at the meeting that day, I truly had thought that we had made it through the worst. We had made it through the summer before. We had made it through a little surge in late fall, but come to find out that we weren't through it. And I really thought we were kind of over it and we were kind of getting back to normal. So I will tell you that last surge was incredibly sobering. That is the one word that I can put on it, and just kind of really bringing home that as long as we have a relatively low vaccination rate, we are a community at risk. And if it takes off, it can spread. That surge started, and we could see it coming in the numbers, and kind of kept hoping. And again, a nice reminder, hope's not a strategy, that it was going to go away, but it kept growing. Our staff in the hospital, like, does anyone know? Does anybody care? And the reality was people really didn't know. And we kind of kept hoping it was going to slow down, but because people didn't know, it just kept growing. This also very sobering in that we are a small community hospital, and it does not take a lot to overwhelm us. And so at this point, we have a staff that's very can-do and will go above and beyond. At the same time, we don't have a whole lot of resources that we can flex to. There is no other community hospital down the street, et cetera. We truly did reach capacity. Our point of capacity was respiratory therapy, it turns out. We were able to get more equipment from the state, but we were at the point where we were screening every admission as to whether we could take care of that patient here or we had to send them. So questions. So how I handle challenging questions. And I'm going to move through these last few fairly quickly because I think Dr. Zink will address some of this. I think I will just say that assuming positive intent on everybody's part of that theme of resilience, it's part of how I personally approach behaviors. Again, I have spent a career taking care of people who smoke, even though I am against smoking and smoking can cause lung disease. I take care of diabetics who are overweight. I myself don't exercise enough. So we take care of people who don't always do the things that we want people to do. And we assume positive intent and we meet people where they're at. So the questions around masking, the questions around vaccine, same approach. And meeting people where they're at, addressing concerns, and moving on. I will say that at this point in time, where I think we are at, still working on the vaccines, but also really recognizing that within the healthcare system, that we are starting to see a lot of evidence, both in terms of reports coming out, but also we're seeing it in experiences that in healthcare, we've had a huge delay and with deferred healthcare, and we're starting to see the impact. We here in Fairbanks, I can tell you, we're diagnosing more cancers that of people who had delayed cancer screenings. We are seeing more acute mental illness than we had seen in the past. So we're beginning to see this, and I think we're going to be seeing this for a while. I don't think we've even started to see the impact on what it's like for childhood. So in terms of having our eye on the ball in healthcare in terms of going forward is really moving to not just getting back to normal, but really getting a handle on all the impacts and making sure that we're addressing all of them, even as we're still in the pandemic. Where we are today is a very good place and very worthy of celebration. Again, you know, that resilience, celebrate the little things, or our gratitude. So our community transmission rate is low. I think one of our challenges at the hospital setting is that it's not just Fairbanks. As a hospital, we serve the whole interior, and the transmission rate is actually high in the Southeast Fairbanks census area, which is actually Delta and Toke. And so again, that's a high area of transmission right now. And so that's always puts us at risk. But for us right now here in Fairbanks, it's a low transmission rate, low case rate. Our testing positivity rate is very low. Our vaccination rate, we would love to be higher, but it is increasing, which is the main thing. So I think we're in a very good place. And I just wanted to kind of close with, we I think very fortunate to live in a time, or at least I feel very fortunate to live in a time, for me, this moonshot, you know, the vaccine is a moonshot. And the fact that we have a vaccine that is so effective, we don't see breakthrough infections. There are a few, but they're really infrequent. We did not see breakthrough infections that's being part of our hospitalizations when we had that surge. They were all unvaccinated people. So to get a vaccine so quickly, so effective, is really a moonshot. I think the story of the scientists who developed that will be something we will be seeing in the movies, how they started while we were working out here and kind of arguing about masks and trying to figure out how to get tests done and how to do this and how to put plexiglass. They got to work day one behind the scenes and it started what they do, figuring out the vaccine and how it works. And so we're, yes, extremely lucky and extremely fortunate. So at this point, turn it over to you.
Dr. Ramirez, thank you very much. Undoubtedly, there'll be questions, but looking at the time and recognizing we have an hour, we do have Dr. Zink online. Dr. Zink is the Chief Medical Officer for the state of Alaska, has been called the Dr. Fauci of Alaska.
Thank you.
He is arguably the most trusted voice regarding Alaska's efforts related to COVID-19 pandemic. Highly regarded across the state as an emergency medicine physician and a thought leader regarding our COVID response as a state. She has a Facebook fan club who, in tribute, established a Think Like Zink hashtag. Unfortunately, she was not able to be here in person. However, I believe we have her online. Is that right, JC? And there we go. Here's Dr. Zink. Delighted you're with us. And after your presentation, for those who have questions in the room, I'd like to give you the microphone so it's picked up on our recording. So thank you, Dr. Zink.
Great. Thank you so much. My powers, it's great to see everyone. I'm so bummed I'm not there in person. We are talking about trying to get up there later this month. So I hope to be in Fairbanks in person again here shortly, but just couldn't quite fit it all in the day. And again, apologies for being a little bit late as I was multitasking. Dr. Ramirez, it was great to hear all of the fantastic work. It's been fun to watch different places across the state and their ability to respond. And I loved your gratitude board and the way that moving forward. So I thought I would just share a brief presentation of a few things that we've just kind of learned about COVID and kind of next steps where we're going from here. I sometimes joke that I'm not the chief medical officer of COVID, but the chief medical officer of DHSS. And our mission is the health and well-being of Alaskans. And as Dr. Ramirez just talked about, that includes the mental health as well as the physical health. And how do we take what we've learned from this pandemic? How do we take what we've learned about healthcare in Alaska in general? And how do we look towards a brighter future moving forward? So I'm just going to go ahead and share my screen, and thanks to the team there for setting it all up so that it would go through. So I'm just going to run through a couple slides here. And can you guys see that okay? It's giving me a little bit of an error here. So I'm going to assume so, but let me know if you can't see that okay. So just going to kind of talk through a little bit about, where we've been and where we're going with COVID-19. I think that this next slide really, to me, this is the cases in Alaska compared to the cases in other states. And we've done a lot to be able to slow the spread within the state of Alaska. We've done better than most other states, particularly when you look at our deaths. Part of that's just been that we've been able to do a lot of testing. We still do somewhere between 2 to 3 times as much testing as the lower 48. And I think that testing has allowed us to see cases early. And by seeing cases early, we can identify them and just inform people that they are potentially infected with a highly contagious virus and to minimize their spread. We were actually just working on a variant case today that got tested at the airport, which was fantastic to see. It didn't expose anyone else. And they just did it on screening upon arrival and we were able to get tested. But what you can see in this slide is the blue is our cases, and then all these other lines are the other states. And in general, we followed other states. And so when there would be a surge other places, we could get a surge here as well. And I think it just really highlights the fact that we all live and think that we're in these communities, but we are all incredibly interconnected with the lower 48 and the world as a whole. Until we have vaccines widely spread across the world, we're going to continue to see this virus continue to spread around. You can see that first wave, that was the very beginning. We just had that little bump there, our wavelet, we have called it since then. And then you can see there was kind of the second wave, and we got a little bit of a surge there. But then really the whole US kind of right in that October, November kind of surge. And that's when we were having the majority of our cases came down. But then as Dr. Ramirez was just speaking about, we've continued to have these little waves that have continued as we've continued to have outbreaks, and they can overwhelm a system really quickly. It's happened down in Petersburg kind of first, it happened in Fairbanks, happened in Ketchikan, and we were just working over the weekend on supporting Prince of Wales region because they were having a lot of very severe cases out there and getting them additional resources and supplies. So unfortunately, we're going to continue to see cases spread across the state until we can really increase our vaccine rate in general, and why we're trying to do everything we can to increase vaccines across the state. But regardless, we are outside. Cases in the US are going down. People across the US are getting vaccinated, and that is helping us as well. And so today is the first day that we have been solidly in the yellow, which has been fantastic. I never knew I loved the color yellow quite as much as I do, but we are now less than 5 cases per 100,000, which is a fantastic place to be at. And so doing everything we can to try to keep us there as much as possible. So here's some fun pictures of just different ways of getting to this point and where we're at today. You guys have done amazing work, but it's been just really neat to see everything from firefighters, helping to bring chairs to the cinema when they were open to be able to provide vaccine there, as more people were showing up. Festivals, on the bottom left are some of our language interpreters, trying to make sure everyone has access to the information. And we're at this point now that 12 and older can get vaccinated and get back to a normal, healthy, happy school year next year. I was just on with sports teams earlier this afternoon. And what a bummer it was if you guys watched the recent golf championship where the leader in the golf tournament tested positive for COVID and was not vaccinated, and so had to be pulled out and lost his chance. I think at $1.4 million, some huge amount of money he wasn't able to compete for, even though he was in the lead because he tested positive for COVID-19. So really getting our kids to be back in school and to play and for sports and not having COVID get in the way. Our key task there is to vaccinate. So these girls were super excited to be able to not have to worry about COVID in the same way moving forward. So that's after their first shot. As mentioned, the Pfizer is available for 12 and above, Moderna is 18 and above, and the Johnson & Johnson or Janssen vaccine is those are 18 above and it's just a single shot. We still have all three in the state. The Johnson & Johnson Janssen vaccine has had some production challenges, so we haven't been getting additional allocations of that recently. However, we still have some in state and we continue to have it and have it available as people need it. I do think that we're going to be able to move down to likely the 2 and above this fall, looking at the enrollment on the trials and talking to colleagues across the country and the CDC. If those trials are underway, and we want to make sure that we've got the data and the science and the evidence before we recommend anything, but those trials are well underway, and we don't have any reason to suspect that they wouldn't go well, but we'll continue to follow that, and they'll probably happen later this year, which is pretty exciting overall. You know, sometimes I joke that I'm not the CMO of COVID, that I am the CMO of Department of Health and Social Services, as I mentioned, and our mission is really to promote the health and well-being of Alaskans. And we just really want to continue to be thinking about what that looks like. And I think that COVID has really highlighted some huge health inequities, social inequities that we can see across our state as well as across the country as a whole, and really emphasize the importance of taking care of our own individual health and making sure that our immune systems are strong, our mental and physical health is strong. It's a great way to take down viruses. And vaccines are just kind of a way to teach your immune system to help to take down the virus if you happen to see it. So healthy habits matter. And, you know, we spend a lot of time talking about healthcare when healthcare can often be sick care, and we have a lot of ownership in our own individual healthcare. So things like providing your daily routine so that you have a sense of control of your life. I think this has been challenging as people are starting to like merge back into the workplace. And Dr. Ramirez, to comment on this slightly a little bit earlier in the presentation, you know, we've all had really different experiences with COVID, and we're all coming back together at this in different ways. And so really having that space and grace with each other. Maybe people are immunosuppressed and they still need to be wearing a mask. Maybe they're done with it and they're fully vaccinated and they're back in the game without a mask. We all have different experiences. I think, you know, I'm trying to remember how to wear high heels in for meetings rather than just standing at Zoom meetings all the time. And commuting takes a lot longer than I remembered. So all of these things get back into there. So think about our healthy habits. And that also includes sleep and exercise, as well as eating healthy, reducing stress for overall improving our health. I do have a friend who's an emergency medicine physician. At the beginning of this pandemic, he saw how clearly obese people were affected, and that if you were obese, you were just much more likely to get COVID-19 and get super sick from it. And so he recognized that he was obese. He decided to really crack down on his individual health. And within the first about 5 months of COVID, lost 100 pounds and has kept it off since that time. And I think it was a great example of the ways that we can use this opportunity to inspire us all for those healthy habits moving forward. Community, man. If we've learned anything, I saw this one social media post and someone said, I wasn't a hugger before COVID, but man, it's the biggest thing I miss. I think we've really seen how nonprofit organizations, how our community members make a huge difference in our overall health and well-being. I've really come to believe that schools are the front line of public health, working with families and communities. And the more that we can support them and families and children, the healthier we're all going to be overall. And finding ways to reconnect with people. You know, asking people to not be connected is kind of like asking people to hold their breath. And they can do it for a bit, but they can't do it for super long. And I think that we need to find ways to continue to reconnect. Louisa Castrodell, some of you may know her, she works on our EPI team. We were on an echo the other day, a science echo, and she was like, I think we all just need to give each other more hugs. And so, you know, we have vaccines, we have a way to protect ourselves as well as our community and each other. And it's the time to try to reconnect and make sure that we are helping to support our community. I think that's one of the things I've been so inspired by the Fairbanks community since the beginning. Finding ways to relieve the stress. Again, this has been a long haul, but our bodies and our minds need a break. So finding a time and a break and a way to process. And I think it's really hard to process everything that has happened over this past year. For healthcare workers, for EMS, for teachers. I was down in the Kenai. I had more teachers come up to me and give me a huge hug and just start crying and talked about how stressful this year has been in changing their protocols, making sure their families and kids were safe and healthy, and what that looked like, and kind of just taking this huge deep breath and trying to recover the summer to get ready. So if you can do one thing after today, thank a teacher or a childcare provider for the work that they have done over this past year. It's been hard on so many, but I really appreciate the work that they've been doing and finding ways to manage that stress for your overall well-being. And as you know, Dr. Ramirez kind of talked about the last end, we do see a real increase in mental health challenges at the moment. We have seen, unfortunately, an increase in our overdoses from heroin across the state. We've seen an increase in calls to our call line for crisis care. We want to make sure that Alaskans are connecting with each other and finding ways to support each other, as well as professional support if needed. And that's just sometimes acknowledging the anxiety, the grief, the loss that could have happened. Maybe you've lost a loved one to COVID-19. Maybe you lost a loved one to not COVID-19, but you weren't able to see them or you weren't able to travel, and what that looks like and what that means. Or maybe your kid missed out on a bunch of events this year. And so I do think that to be able to process through this year and move on to a healthier tomorrow, we do have to kind of reflect on what that looks like. And then building a relationship with a primary care doctor. Many people have missed their regular checkups. Many kids have missed their regular immunizations. We've seen an increase in cardiovascular deaths as well as malignancy deaths or cancer deaths. And the big cause that we think from that is from missing things like screening colonoscopies, screening mammograms, going in for symptoms because people were nervous to, afraid to, didn't want to travel at the beginning or missing their checkups. And so we want to make sure, again, that we're not just addressing COVID, but we're addressing the overall health of Alaskans. And so really getting in to see your primary care doctor. If you haven't done it, set up your dental appointment, get your teeth cleaned, make sure you get checked out. This is the time to do it. Our cases have really come down. Vaccines are out there. And so this is the time to make sure that those childhood immunizations, other health screenings, dental cleanings are taken care of. And then finding ways to feel joyful in this time of crisis. This is actually my kiddos up there with you all years ago up at the ice festival. But I always loved the ice festival because it was like taking this cold, sometimes sharp substance that is around us that can be so beautiful, but really taking it and creating it into these just amazing works of art and surrounding us. I think that's part of what I've always loved about art, but particularly the art festival. There was a great little little ad that I saw recently, and it was a bunch of people with a sign showing what they lost from COVID, what was hard in COVID, and then they flipped it over on the other side, and it was what they've gained of COVID. And I think the stories we tell ourselves and how we recover out of this is going to be as important as how we responded into it. So what did you learn? How did you become more resilient? How did you become more strong this year? When my kids started school year this year, I said, I don't want you to think about what you're missing this year. I want to think of this as the year of your resilience. How are you going to be uber resilient this year? What are you going to do to build your sense of resiliency? And that's my one ask for you this year. And they did become more resilient in different ways, but they're also really enjoying connecting with friends now, not having to be so resilient now that they're vaccinated and moving forward. And I think from a systemic and a big kind of picture, we've learned a bunch of different things at the state. IT systems have failed us. I oftentimes felt like I was swimming upstream with weights on my ankles and arms, trying to hold me down just with the IT systems that don't cross with each other, that don't interact, and how incredibly hard it can be to get basic information, both to the state to provide information, but then back to communities so that they can make informed decisions, or back to individuals. So spending a lot of time on that and trying to improve that. The importance of non-traditional healthcare, as I mentioned, things like schools and our EMS, like down the Kenai, and been going down to every house that has more than 3 people to bring vaccine to them. All the work that's been done with the homelessness in Fairbanks region to be able to get vaccines out, as well as to make sure people have a safe, warm space to be. How to better address the social determinants of health and these health disparities. We actually just got a big health equity grant, and thinking about, again, what makes our communities healthy and well, and how can we make sure that we have not just equal access, but we can try to get equitable outcomes at the end of the day. Try to make sure that we're serving people in ways that really promote health across the board, not just because they're easier for a single system to provide them. And then again, mental and physical health are one. And how do we move from sick care to well care? How do we continue to move upstream towards prevention? Because it is a lot cheaper and it's a lot easier to go about your work and your school and your daily life with prevention than it is on the other end. So for the summer, we're just really excited to see Alaskans outside, enjoying Denali, enjoying the sun, and fiddlehead ferns I was just picking the other day, and being outside. Getting your sleeves up for summer. We have vaccines out in a way that we never did before, and really encourage people to ask questions, talk to your primary care doctor if you haven't decided to get vaccinated yet. Interestingly, we did some research here at the state of Alaska to see who was most influential for people to get vaccinated. It actually wasn't healthcare providers, it was friends and family. So you sharing with friends and family why you may have made the choice to get vaccinated can be one of the most influential things. And there's still an impressive number of people who have said, I haven't gotten around to it, or I'm just not sure, or I'm worried about long-term side effects and I wanted to see more people. And Dr. Ramirez talked about that, she'll continue to care for someone, even if they smoke. Someone will come into the emergency department struggling with addiction time and time again. And maybe it's the 20th time I see them, or the 21st time I see them, that they're ready. And maybe it's the same with vaccines. Maybe I've had the same conversation or a slightly different conversation multiple times with a patient, And maybe on the third time or fourth time, that's the time that they decide, no, now I'm ready to go ahead and make that decision for myself. And so we, the state, want to make sure that Alaskans have the same information that we have to feel comfortable in not only getting ourselves vaccinated, but our children, our spouses, our parents, our loved ones vaccinated, and be able to really put this pandemic behind us, because we got a lot of other work to do together to think about the health and well-being of our community and our economy. And this is our ticket out of here. And the quicker we can do this, the quicker we can move on. So with that, I'll hand it back to you, Mike, for any questions, and excited to hear your thoughts and perspectives.
Great. Thank you very much, Dr. Zink, and thank you, Dr. Ramirez. Let me ask questions in the room. I'll check online, but Rich? Oh.
Yeah, I got the COVID update for the trustees of the hospital today on the email, and something has been bothering many of the trustees, not all of them, and that is the rate at which the hospital staff and medical staff get vaccinated and what the vaccination rate is. And I talked to the Newsminer editor about this and whether we should ask this question statewide. But is there any hospital that's demanding that staff get vaccinated? And if not, why not? Or what's the driving force here? Because there are members of the foundation who just say, why don't we vaccinate everybody in the hospital? This just makes good public health sense. And I don't get a good answer to that. I just wonder if anybody around the state is doing that in any of the healthcare facilities.
Yeah, so I can attempt to answer from the state perspective, Rich. I appreciate that question, and we have been getting it quite a bit. None of them that I'm aware of have formally and publicly come out and said that we are mandating or requiring it. We have heard some of particularly the Southeast healthcare facilities saying that it's going to be a condition of employment to be able to get vaccinated. So while it's not a requirement yet, they're clearly messaging that that's the direction that they're going to go. There's clearly precedent for this before. Many hospitals have required vaccines for things like influenza or getting your TB checked. There's also state and federal law that supports asking for and or requiring vaccines as a part of employment or for other reasons, particularly as you're mentioning with healthcare facilities. Common questions I get are, common answers I get are, one, we're waiting for a full approval versus an EUA approval. There's a lot of lawyers who speak about this on multiple sides to see if that's really a legitimate argument or not, but that's something that I do hear regularly. Both Pfizer and Moderna have submitted for full approval, and we do suspect that this fall. There's no additional studies that need to be done. It's just usually that they wait for all the age groups before they go ahead and give a full approval. So that's what they were waiting on, but they decided to go ahead with the 12 and above for Pfizer to go ahead and submit for a full approval, and the 18 above for Moderna. And I think in some ways it's become political, and healthcare staff are hard to find within the state. And so I think that's the other concern I oftentimes hear is we want to mandate it for our staff because we really want them all vaccinated because it's better for our patients, it's better for our staff. We don't have to pay for quarantining. But on the other hand, we just are worried we'll lose too much staff. Other things that I've seen healthcare facilities do, and many schools are now doing, is saying that they won't pay for your quarantine time if you get exposed. You're exposed to someone with COVID-19, that's your own personal leave time rather than paid for time. And that has been another incentive just because many school districts, hospitals, healthcare facilities had spent a lot of money on paying people to quarantine so they weren't at the workplace. But there's some perverse incentives that can happen there too, where people may not disclose if they were exposed to COVID-19 and then potentially exposed patients. But Dr. Ramirez, I don't know if you have anything else more local that you would add.
Sorry. Oh, there we go. It's on.
Yeah.
So the issue here in Fairbanks that we've had, and I'm sure you saw it in the report or you've heard, the challenge we faced is the staffing. We are challenged with staffing in terms of hiring that we've never experienced before. We have vacancies in all of our positions, including, I think there's a term that they're using right now, the business as usual positions, entry-level positions, phlebotomy positions, as well as CNA type positions. And so with the high level of vacancies, we are having a lot of staff work overtime. And so there are staff who are concerned about the vaccine, and we really can't afford to lose any other staff. I think the other challenge is we've taken the position that it's under the EUA, and that as more and more people get comfortable, we do expect it will be mandatory and a condition of employment in the future. We are requiring it for travelers and any locums coming in, that they have to, as well as we're requiring it for volunteers. The other thing that's making the rounds right now is a hospital in Houston, I believe is the first one that's, I'm not sure how much this is truth, but it's circulating on some of the websites that Houston Methodist, I think it is the first hospital that's mandated it for all their employees. And now the staff are having protests and suing. So I would just say that it's from a position of staffing is the first. And I think the other piece is I think it's the right thing to do, but we're also kind of taking it from the approach of, so right now, champions. And so Dr. Nace has been part of the team that's really going out and educating people one by one. And quite honestly, trying to take the same approach with our staff that we're recommending for everybody out in the community. And since that team has started working, we've seen the rates go up. So we're actually kind of happy that they're going up much faster. We had initially vaccinated and had about a 60% rate. Then it was pretty much stalled. And now it's up to 74%. And that really increase came in the past several weeks with this latest activity. So.
Thank you. Interesting. NPR had the story on the Houston Hospital yesterday. I don't know if you caught that, but it's a great story on that requirement of vaccination for all employees. Other questions? Yes.
All right. Kudos to healthcare people. I understand they've gone through more than we can imagine. At the same time, we've spent a year, many of us, without physicals, and so that's catching up with a lot of people. Would you say that people who are immunocompromised have a right to know if their healthcare people are vaccinated or not? One thing that might help is over a year ago, Michael Mina, epidemiologist at Harvard, was pushing this, and you know more about it than I do, a very cheap $1 a piece, mass-produced saliva test, 15 minutes. And I'm surprised that vaccines have made such a difference, but especially after the previous administration who said, slow down the testing, you just find positive people. I think we really need to, everybody should be tested. I mean, these saliva tests, bouncers could hand them out at bars. Kids could take them twice a week before they go to school. And I was in Italy when this hit. So I got serious quick. And there was a town where the first person died in Italy, but the mayor was a pharmacist. And he shut down the town and tested everybody. He found out most of the people positive were symptomatic. So if we can simply, I thought by this point there would be free, available, good test that, and we just simply, like it or not, the people that are contagious can stay home until they're not contagious. This thing about the poor leper who's lost his bell, wandering the world, meaning no harm, doesn't cut it. So can we test more? Are the people at the hospital? I'm not saying force people to get vaccinated, but the patients have a right to know who isn't. And mostly we just need to test more.
Great question, Dr. Zink, and then Dr. Ramirez.
Yeah, so happy to jump in on that. So for the first part about, do you have a right to know? I mean, yeah, you as a patient have a right to ask that question. They may or may not disclose it, particularly if you can't mask or you can't distance yourself. I know that I asked my dentist and hygienist before I went back because I couldn't have a mask on, like, you all fully vaccinated in your office? Because I only want to go to a dentist that's fully vaccinated. And they all were. And so it was great and able to see that. So I do think it's a reasonable question, particularly for someone who's immunocompromised, to be asking, because it is a right for you to know that for your own health information. And if they choose not to answer, then maybe that tells you something as well. Regarding your second question regarding antigen tests and Dr. Mina's work, it's gotten a lot of attention. They are available now. Walgreens does sell the Abbott, the Buy Next Now cards, which are kind of one of the rapid testing. They're more like $30 for two, so they're more like $15 a piece. So they're not quite as cheap as $1 a piece. And that has to do partially to production. I also thank the company. But I know that like when I was out of state, and my daughter got a runny nose, I thought it was from allergies, but I just wanted to make sure I actually ran to Walgreens and picked one up myself. So they are starting to become more available. We also have lots of those available in a warehouse at the state that we're oftentimes working with communities to say, how can we get them out and available so people can use them. Dr. Nace can speak to this, but we've been working with schools. There's a large grant that we have for testing and vaccines for schools and have offered saliva testing, pool testing, Buy Next Now card testing, essentially all for free for the schools in any way, including money to help support staff so that testing can be a regular part of identifying cases early, like you mentioned, just to keep them away. I do think that the antigen tests, they're not quite as sensitive, and so you have to do them more often if you're really looking for screening purposes, but they have played a huge role. And for example, in the YK region, when we had a ton of cases, they started to test almost the entire population who had not had COVID-19 before twice a week with the Buy Next Now cards to identify cases early. So we've used them in huge geographic regions with a lot of people to be able to identify cases early when we're really having a hard time doing any sort of meaningful contact tracing and isolation. And people really lived in congregate settings. So we stand by to support any industry, any business, any school to be able to offer rapid, free, available testing. And we'll continue to offer testing at the airports for free as again, an additional tool. And the airports can also test you even before you get on a plane. So if you're, or on a party and you're not sure you want to leave because you might get stuck someplace else, you're welcome to get tested there as well. And always happy to look at regional variation in testing availability to make that better. But that, Dr. Ramirez?
Yeah, so first the question around the, can you ask your provider, your nurse, the clinician, if you've been vaccinated? We've been getting those questions at the hospital, and it surfaced in some type of meeting, I can't recall which, and was asked whether that's okay or not. And it's, again, the position has been, patient has a right to ask. We can't guarantee that what answer they'll get. So we've been actually trying to help our staff on how to respond, because it has made some staff uncomfortable. And it's made some staff who are vaccinated uncomfortable as well to explain. They just don't know how to. I guess what I'm trying to say is a lot of what's happened with COVID and the pandemic is new. And I think what we have seen is at times there's a lack of trust between patients and clinicians. And when we get into questions like this, sometimes people are uncomfortable regardless of what the answer is. So we've tried to help script, and that it's okay to answer the question. It's okay to accommodate if we possibly can. Sometimes we can't. And then part of the scripting and the answer back is we have in place protective measures that we put in place, the masking, the hand hygiene, et cetera. And so that our goal is to protect every patient at all times.
Thank you. We have a question from a viewer, and it's difficult, but if you could perhaps keep it in the medical perspective, we might be able to touch on it a little lively. How did a health issue become political to the detriment of the outcomes? Dr. Zink, you want to try that one?
Sure, I'm happy to try it. I think that the thing that I've just reminded again and again is, unfortunately, this is not new to this pandemic. This is not new to public health. It probably was larger than other places in other ways, partially because of social media and other divides that have been happening in our country and continue to happen in our country for numerous reasons. But I reread The Great Influenza twice during this pandemic, and it's about the 1918 pandemic. And at the very beginning of it, I'm like, oh, wait, this is today. And it talks about what a political time it was. You couldn't talk about the pandemic. I recently reread The Plague. And again, that's back in the 1700s and talking about what was happening then. And it's very similar, talking about quarantine and isolation and not trusting the doctors and wanting these public health measures to just go away. And I was like, this is really not change. And then I was just reading Sometimes Brilliant by Larry Brilliant about the smallpox eradication. And it was just really fascinating to hear all of the efforts to vaccinate in different communities and all the politics that were getting in the way. So think it's easy to think, and it's easy in the moment to feel like this has just become so political, and it really has. But I think it's been helpful for me to put it into this larger historical context that we've had, particularly when you have a disease that is so many people, it spreads silently and are asymptomatic spreaders. And that I think has really added to the difficulty. You know, when we feel an earthquake, we all feel it. When we see a plane crash, we all see it. And so it's easier to have that belief. But everyone's experiences with COVID are so different and they're very real to them. You know, people completely asymptomatic, people have never been affected, people who've lost entire family members to COVID-19. And so when your personal experience can be so different from this kind of this global or state or other narrative that might be out there, I think it's easy to mistrust or distrust the information that's out there. And that's why, you know, we've really tried to do everything we can to make sure our information is transparent, that we take questions from the public every week, and do the best we can to kind of keep our head down from the noise of the politics and just keep trying to look at the science and data and keep in mind that we're here to serve the people of Alaska first and foremost, and keep moving forward. So I guess that would be my one thought on that one. Dr. Ramirez.
I just say ditto. I'll second.
Thank you. Dr. Nace, you want to? I'm serious. Do you, any thoughts on?
What was the question?
No, I would say ditto. Yeah, I think that would be perfect. There has been a lot of, but I find that the thing is that if you can put your place in their shoes for just a moment and try to listen to what they're, instead of trying to get your side out and listen to what the perceived other side is. So those people, when we are talking to them about vaccination, and I definitely believe in it and I want everybody to be vaccinated, but I know everybody is not on that same page. So by giving them the opportunities and ask them questions and help them talk about it and give them more information and listen and let them come to that decision when they come to that decision. And so I think that because there are some people who don't have that same ability in that conversation, it does create that divide. And we've seen that divide. And so our goal in working with trying to get people vaccinated is to try to meet them where they are and to try to give them that information and not judge where they are and why they're making that decision, but just to say, do you have any questions? What is your concern? And to be able to have a conversation, and that starts the ball rolling. And that's what we're working with.
Thank you. We're at the top of the hour. Let me catch one more question before we wrap up today. Anyone? I'll just ask real quickly. Travel. So nationally or internationally, free to go? What's your sense across some of the more popular destinations?
I guess I would say, first of all, make sure you're fully vaccinated because you may not get into countries if you're not fully vaccinated. Two, I would still have a good sense of where you're going and what the travel looks like and the case rate looks in that region. The State Department continues to update their warnings, although it still looks like most of the world is, high risk, even though cases are coming down. We are very fortunate with vaccine. We continue to be one of the most vaccinated countries in the world at this time. And unfortunately, we are really starting to see an increase in many other places. We've seen devastating, outbreaks in India. It's right now really taking off in Central and South America, as well as Africa. And it's heartbreaking to see how quickly, again, the virus can take off and spread with, particularly in communities with low vaccination rates. So I would just make sure you have, particularly traveling internationally, having, travel insurance, looking at where you're going first before you go there, because you may well be in a community that gets locked down or you can't move in and out because of COVID rates overall. Traveling is always a risk factor. And so, continuing to mask, particularly during travel, remembering that when you take off your mask to eat, that's a really high risk activity. And so not having those airport breaks where you're taking off your mask and eating for an extended period of time, particularly if you're going to be, living with another family or visiting someone who's immunocompromised on the other end. That being said, I think as Alaskans, we have to travel for a lot of different reasons, for healthcare reasons, for family reasons, for connection in other ways. And there's a lot of ways to do it safely. And it's the reason we continue to offer testing at the airports. Vaccinated or unvaccinated individuals are welcome to use it at any point as a way to really kind of minimize your spread to other people if you're coming home from a trip or moving towards a trip. So It feels good to travel in some ways. I was able to go visit my parents who I hadn't seen during the whole pandemic, and it was great to be able to travel and to see them. But I think that travel comes with inherent risk. And I've also learned through this pandemic how many laws we have for maritime law that slow viral transmission down and infectious disease transmission. We don't have them for airfare, and that's how our main mode of transportation. So I think as a world, we have to struggle with that and figure out what we want to do about minimizing highly contagious diseases and how quickly we can all travel around the world moving forward.
Dr. Ramirez, any final comments?
Well, just on the travel, I would just add just the cautionary thing, things can change very quickly. And just being aware of that, particularly with international travel. And so one moment, everything can be fine, but a week or 2 weeks later, things can be very different. So in terms of final comments, just really a lot of gratitude, actually. Seriously, though, and appreciation. And I will say from the hospital perspective and FHP, we get a lot of community feedback. And I would say we use it all and we listen to it all. And I think it has really been helpful through this whole year to be constantly having concerns as well as having questions. And that's how we learn how to do better what we do and actually moderate our responses. So really appreciate all that comes in that way and through other forums like this. But appreciate the opportunity. Thank you. And
Thank
I
you
always
very-
learn anytime I'm with Dr. Zink.
Thank you very much. And if I could just ask for a round of applause for Dr. Angie Ramirez and Dr. Ann Zink.